in a hypothyroidic as well as a hyperthyroidic. Their hair texture as well as the hair growth always takes a U-turn. Let us try to understand what are the changes that happens, predominantly 6 of them, and what can be done as a remedy. In a hyperthyroidic, there is hair thinning and oiliness of hair, whereas in a hypothyroidic, there is a completely different change. There is continuous hair fall as well as dryness and frizziness, and there is a lot more to it. Let us try to understand what are those. First and foremost, sudden decrease in hair volume. 2. Continuous hair fall. Wherever you turn, all over you will find your hair. 3. Springing up of baby hair, which were never to be found earlier. Fourth one, there is dryness and frizziness. We shall try to explore what are the changes happening as the video progresses. The fifth change, there is androgenic alopecia, as in there is a receding hairline and you start losing specifically from the 2 corners of your forehead. And the fifth one, spiraling of hair. So let us try to understand why do these hair changes happen at the first place. The hair follows a cycle of 3 phases: anagen, telogen and catagen. In a hypothyroid patient, when the metabolism becomes sluggish, ample amount of nourishment doesn't reach the hair follicle, because of which the hair bulb shrinks, and this leads to the hair fall. Sudden hair fall, that means more number of hairs are going into the catagen phase, and then it goes to a prolonged resting phase because there is lack of nourishment. Now once you resume with a synthetic thyroid pill, or once you start with the Ayurvedic medication and remedies, there is more nourishment reaching these hair bulb, and thus the hair starts regrowing. But as I said, it is not an easy process. Very often, patients find that the hair that they have lost doesn't come back to the same texture, same volume. And that is because there are blockages in the nourishment. So when we try to treat a patient Ayurvedically, we try to remove these blockages, and then we try to make the nourishment in the form of ghee or oil reach there. And that is one of the reasons why you do not find a major change in hair fall the moment you start applying oil. Before you start applying oil, what you got to do is you need to cleanse the hair bulb. This can be done with the help of Kaphahara or Kapha balancing foods, which can be in the form of Triphala plus buttermilk paste externally applied, and then afterwards you can introduce nourishment in the form of ghee in a hyperthyroidic patient, and for a hypothyroidic patient you can start consuming sesame seeds in combination with cow's milk. But ensure that you are not experiencing any pitta related or heat related symptoms when you are consuming sesame seeds. Now coming to why does the dryness and frizziness happen? If you try to observe the changes under a microscope, we get to see that there is something called a cuticle around the hair. A cuticle is something that is like a scale on the surface of fish. Now when you are going through a hormonal change, or when it's extremely summer, the moisture or the nourishment is getting oozed out. So what happens is these scales start opening up like a pine cone, and more moisture is lost. So that is why when you apply oil, you suddenly feel the hair feels much better. It feels much moistened. So as a remedy, what you can also do is, after the cleansing process, try applying more oil to your scalp, not to your hair, but to your scalp, to nourish the hair as well as hair bulb. So these are some of the common remedies that can be applied. Try doing them minimum for 3 months to see a good result.